My God, what is a PFT and why have I never heard this after nursing school? Well, the reason why is two things. A PFT is a pulmonary function test and it consists of two other tests. And, well, two tests. The first one is spirometry and the second one is ABG. You can tell why we don't really use spirometries because usually it's in a controlled environment. It tells us about static lung volumes like forced expiratory volume and FEV1 and forced volume C. What is that? Oh, it's forced vital capacity. I forgot. Anyway, so you've got spirometry with FEV, forced expiratory volume, and FVC, forced vital capacity, and the ratio in between the two. But we don't really do that in the inpatient nursing because we mostly focus on the other pulmonary function test, which is the infamous, yes, you had said it right, ABGs. ABGs are arterial blood gas testing. Now, usually we just rely on inpatient pulse oxes to see what the patient's respiratory status is because we just want to know what the patient's oxygen level is um, in the simplified terms. But if a patient is really having a respiratory issue and we really want to know exactly a little bit more, so we want to know that not just the electrolytes, but the partial pressure, the partial gases of the oxygen, carbon dioxide, bicarbs. I think it was base excess, but I forgot. We don't really use that. So we want to be able to get this information right away because at least in the floors where the patient is having respiratory issues and have to be intubated, usually an ABG will let us know where this patient is going. If you have time for the ABG, if you know, you just anticipate that the doctor anticipates that the patient is going to be intubated, rather than, oh my gosh, this patient needs to be intubated now, you know. So then in that case, they'll probably do the ABG like afterwards, just to see if the patient is making any progress. Anyways, going back to it, the ABG is an arterial blood gas that determines baseline CO2 as well as other very important gases. For example, the partial pressure of the oxygen, CO2, bicarbs, and these are what we use, and of course the pH, and these are what we use to determine the patient if they're having, let's say, if you remember from nursing school, um, respiratory acidosis or respiratory alkalosis. The respiratory part is what we're worried about because that's what's more pertinent for somebody that's about to get intubated. Whereas if somebody has any acidity, which is metabolic, which either somebody's puking or if they're, let's say, they're going to DKA, that also gives us some information from